Well, good day. My name is Greg Downing. I am the owner of Funny Healthcare and Obamacare Made Easy, and today is October the 17th, 2013, and guess what? The health insurance marketplace is still not working. Now, I have been able to establish an account, woohoo, and I've applied for subsidies or tax credits, and believe it or not, I have got them. The problem is that's as far as I can get. I cannot log on. It's still broken, and our folks on the inside tell us that it's going to take a couple more weeks before they get the bugs worked out, so let's keep our fingers crossed. So if you're like me and very impatient and I don't have time for this, I've got people I've got to help, and you want to know more information, another way that one can access is, especially if you're in Texas, you can go directly to an insurance company that is in the exchange. And one of the good ones here in Texas is Blue Cross and Blue Shield of Texas. And they actually have a subsidy calculator where you can get your estimates. And by the way, their estimates were exactly the same as mine that I got from the government. So they seem to match up. So that's good. So what I would recommend is an easy way to do that is go to our website, just Obamacare Made Easy, and hopefully you can see this okay. But if you'll go down to Nurse Betty right below her and see this link right here, if you will click on that link, that takes you to another one of our pages, is ready to enroll in the health insurance marketplace, which we're not quite, but let's go ahead because we want to find some information. You click on this link right here, takes you directly to Blue Cross and Blue Shield, and that's where you can simply create an account with them. And what you'll want to do, I've already completed some of this information because I wanted to speed up the process, but you'll need to put your zip code in there, and then make sure you clarify what county, and you enter in who's all covered. So like what I'm doing is I've got myself in here and I've got my 2 kids that are covered, and enter that information in, and then what you can do is go to view your plans. View your plans. What is it that I need to do? Okay. All right, well, I don't want to. I won't. So this is actually, I'm in temporary coverage. We don't want that. We want to have an effective date. Here, no, we don't need a short-term plan. So, but if you do need a short-term plan, you can get this between now and the end of the year. So let's go back over here. I'm sorry, view your plans. Excuse me. So we click on that. Some of your applicants got to make sure, they want to make sure, does anybody use tobacco? No, they don't, that they tell me about. All right, so then what this is going to do is it's going to take you here to a screen that says, hey, you may qualify for tax credits. Do you want to get your official tax credit? Take 45 minutes? No, do not go there. Take 45 years. What you want to do is use this premium credit estimator. So click on the blue one where it says that, and you click right there. And I'm going to say that I've got 3 in the family, and I'm just kind of consistently using this. And let's say that our income is $30,000 for the household income. And you just click right on the estimate. Wow. So what this says is I'm going to get a $477 premium tax credit, which I can apply to buying insurance. Now, where do they come up with this number? Well, this is based upon the lowest cost of a silver plan, and it's based upon how much money I make. So it's all depending on that, but you can play around with this and find this. And then what you want to do is you want to apply the credit, and then watch the magic thing go around. This is the way it's supposed to work. So if you look, what you'll find is that on here, there is the premium. No, stay away from that. And then there's actually 38 matching plans. And just to let you know, in Williamson County where I live, there is 80 plans to choose from on the health insurance marketplace, which is completely overwhelming. I recommend most people just go to Blue Cross because they're in all the states. I mean, they're in all the counties in Texas, and if you don't live in Texas, you can get an idea how this is supposed to work, and it's a good way to learn about the different type plans. So with this feature here, it's a way that you can sort. I'm going to sort by the metallic level to start with because I like the way that sounds. But remember, the bronze plans are the lowest plans that are the least cost plans available. So in my situation, if I earn $30,000 a year and I have 3 people in the family, what you'll notice is I can actually get a plan that doesn't cost me anything. Now granted, these are HMO plans, and what you need to know is an HMO plan is going to have about 1/3 as a doctor's in it as a PPO plan. So if you've got the money, the flexibility, the PPO option is the best way to go. But in this instance here, let's just say, well, geez, I can't afford anything, so I could actually get a bronze plan that wouldn't cost me anything. And so one of the things you can do is you can select that. I'm just going to show you. We're going to click that one. And I'm not going to go through all these because there's just way too many. What I would say, if you're going to choose, if you don't want to make a premium, you can remember the blue Advantage HMO 6. And if there's any way possible that you can bump up to a silver plan, let me show you something right here. And you can see that this money is applied, or the tax credit is applied to the benefits or to the plan. I'm going to scroll down here, and you want to write this down just to make it easy. We're going to pick another plan to compare is the Blue Choice Silver PPO 4. And you'll notice this is dark, and I'll explain to you why it's like that in a minute. And you'll notice that this plan, if you look down here, it's the exact same plan, but you can see there's no subsidies applied to that particular plan. I'm going to, even I get confused on these things. I'm going to pick this one right up here, PPO. Okay, so, and then I'm going to slide all the way down to the bottom, and then we're going to compare 3 plans. All right, now this is what I would recommend you do, is you can compare 3 of the plans. So let's say that you can't budget anything. So let's to spend on health insurance. Now what you need to know, HMO, smaller network, the deductible is going to be much more, and it doesn't cover any office visits. Everything else is the same, but you have to meet your deductible first, and it covers the whole thing. If you look at prescription drugs, the way prescription drugs is you have to meet your deductible first before they're going to pay anything on that. But it has preventive coverage, and if something horrible happened, the maximum out of pocket you would be $6,000. Now here's something that you want to pay close attention to. One of the things about if you choose a silver plan, not only will they help pay for your, give you a tax credit for the premium, but they'll give you a credit for the copays and out-of-pockets. Now these are the exact same plans, but for an extra $284 a month, or that's what you would pay in my particular situation, if you go with a silver plan, and if you make less than 250% of the poverty level, they will subsidize your out-of-pocket cost. Instead of it being $6,350, it will only be $1,500, which makes a very big difference. So if you can choose a silver plan, that's always the best bang for the buck. So you'll notice here what happens on these 2 exact same plans. Instead of being a $3,000 deductible, it's only $500. Instead of being a family deductible of $9,000, it's $1,500. So other than that, these plans are exactly the same. I'm just showing you what a value it is to be able to go and select one of these silver plans. Now here's another option. We're going to delete this one. We're going to click on this so we can add another plan. And I'm going to say, now here's a way you can get a really good bang for your buck as well. We're going to pick this plan and compare it. All right. So this is, so for $104, if you can bump up and you can use an HMO network, which again is going to have less doctors in it, but look at the difference in your out-of-pocket cost. It goes from $1,500 to $6,000, and you get co-pays with this. So when you go to visit the doctor, it's only $30. And the other thing here that's important is on your prescription drugs, generics are free. Non-preferred generics cost $10, and you can see they cost more as they go down. But as I look at everything, what I would say is these are 3 plans that I would select from. Matter of fact, if I can ever get on there, I'm probably going to choose this plan right here, the PPO 4 plan, because I can afford that. That's a lot less than I'm paying right now because of the subsidies. But if I couldn't, these 2 other plans, these HMO plans, are ways that I can get coverage. But of course, if you go out of the HMO network, there's no coverage. So I'd probably beat that horse to a death. Now, what you can do is, we can't buy these plans yet because we're applying for subsidies. And so let's say, well, I'm ready to go. So if I select this plan, it's going to load and it'll tell me, okay, to get your official premium, and this has my phone number all on it so you can call me, I have to create an account, which I've already created an account for. So I'm going to log in. And then it gives you a list. Before you go get your official credit, make sure you got proof of citizenship, which actually they didn't even require some of these things. And then here are the things. If you want to print this so you've got them, that's a good idea. And then this will take you directly to the exchange. And then we'll see what happens just for fun. It might work. Not sure. Let's just see what happens. Let's be optimistic. Okay, we're going to log in because I've already created an account, like I said, with the healthcare exchange. And this is what happens. It basically freezes up and it won't do anything. So it just goes there and nothing happens. So that's not real helpful, is it? No, it's not. All right, so let me swap this back. So what I'm going to do is I'm going to forget about it, and I'm going to go, I know, we're going to try again. Resend. Just get me out of there. So it's supposed to kick us back, but as you can see, it doesn't happen. I know. We want out. We're sick of you. Okay, so don't do that until we tell you. But you can continue to shop, because the truth of the matter is, like I say, it's going to be a while. But so if you want to go back and let's view some more plans. And you can play around with all these different plans. You can put in different subsidies. There's ways you can sort them. Now, if you don't have a tax credit, see, this is pretty simple. Let's find one just to show. Okay, so let's say I wanted to pick one, and this one where they haven't applied the tax credit, and if I selected it, then I can go right here, and then I need to either have dental coverage, or like I would need to get one, say I want the one for $55 that covers kids. So I have to add that to that. Check plans. I'm not going to go through all this, but if I wanted to buy the plan for 2014, I could do it right now, and it would all be here, blah, blah, blah. So, but one can continue to shop. That's an easy way to get that, and also show you, the different plans are available, and quite frankly, 38. Well, really, there's 15 plans, but even that's too many to choose from. So that's an easy way to go take a look at the plans that are available. Now, if you are not in Texas, we're just going to have to be a little patient. I know that if you want to email me, greg@funnyhealthcare.com, there's actually a way that you can see. I can send you a link that will show you what providers are going to be in your exchange in the healthcare marketplace. So just send me an email at greg@funnyhealthcare.com, and I'll send you that link that I got from healthcare.gov, where you can just put in your county and you'll be able to find what healthcare providers are going to be in your particular county. Anyway, I'm going to wrap that up, but that's a way to take a look at it. Please call me if you have any questions, and I hope this was helpful, and y'all have a great day, and I will give you more information as soon as it becomes available. And as my friend always says, be patient or become